have this dialogue. What is the significance of socioeconomic status and healthcare disparities?
That is such a broad concept, and I love that idea because it is so profound, the difference in treatment that people of different socioeconomic statuses receive and are able to receive. I think something that I've seen mostly in my experience is the difference in available, like, proactive treatment. And so people with socioeconomic statuses that are lower than others end up with more chronic, lifetime long problems, and they're in the hospital more, which costs more money, but these things that they have, like, are preventable, and there are risk factors that can be changed and modified. And so I think that's where I've been very frustrated with the healthcare system's lack of trying to equalize that a little bit.
Yeah. Can you talk about what kind of chronic diseases you mean when you say that?
Yeah, for sure. Specifically, I think on the unit that I'm on, we see a lot of diabetes, and also the price of insulin has gone up dramatically. So not only do they not get, so this is type 2 diabetes specifically, not only proactive treatment, but like treatment now.
Right.
Not good. Heart disease, specifically heart failure, and like atherosclerosis, and a lot of this can be changed by modifying your diet, and I think other preventable diseases, but a lot of times like pneumonia or things where just the conditions that you're living in.
Right.
Totally.
And just like a lack of education and things like that. Interesting. I remember in one of my classes I took, we talked about, or watched a video about the rate of diabetes on like Native American reservations.
I think I've seen that video too.
Yeah, and that was so fascinating because I think in the general population it's like 1 in 3 people, and in on a Native American reservation it's like half, like literally half of their population will have diabetes type 2 at some point in their life. And that's hugely related to like what they have access to there, which is not healthy things, not good education, or good healthcare and preventative.
And I thought something that's profound about that was the instances of diabetes before the American government intervened was non-existent. Whether it was undocumented or actually non-existent, I guess we won't know.
Like before colonialism?
Yes.
Okay.
Yeah, like way long ago. But now, as the government was trying its best in some regard to fix the problem or to help in increasing subsidies and things like that for these Native Americans that are living on these reservations, they've given them like the cheapest kinds of food, and the lifestyle that they have been given and been provided is one that's not sustainable and that's not good for them. And so the only food they had access to was food that was causing these diseases.
Right.
But that was provided by the government.
Right.
And so I think that is just confusing, but also like the government doesn't necessarily know, like they didn't know when they were doing that this was going to be the outcome. But I think now that they know it's the outcome, like something has to change.
Yeah. I think kind of going off on a different tangent, what about like insurance and affording healthcare in general? Because I mean, people of lower socioeconomic status can't afford those like fancy insurance plans and or insulin and medications that they need to stay healthy. So I think that's another huge factor relating to that. I mean, they kicked my grandpa out of rehab once because his insurance ran out.
Seriously.
Yeah.
Wow. So I think I don't know enough about how insurance works in order to know how to solve that problem. But I think another way we could look at this is the proactive treatment again. If we had a way to reach people who can't afford insurance or do not have jobs that provide insurance with these like proactive ways to live life, I think it would be just significantly less expensive for them in the long run.
Right.
Where they don't have to go to the hospital to seek
Yeah.
treatment because they're actually already healthy. But the problem is you can't just tell people you need to exercise more and you need to eat healthier, because those things cost money, time, you need a safe place to do all of those things. And I think everything is just so confounded.
Yeah. That's such a good point too, though, about, like, it's easy to tell someone in a doctor's office, you need to eat healthier, you need to exercise, but if someone's working 3 jobs and has 4 kids at home that they need to take care of and can't afford to pay rent or much less buy a membership at a gym, yeah, that's just not asking something that's a possibility realistically. Interesting. Can we think of like any other explanations for the disparities other than like access?
Can you explain what that?
Like, so far we've talked a little bit about like how they don't have good access, like even if they are receiving adequate teaching from their health office, they just can't afford healthy foods or medications or whatever. Is there anything else that you think might have roots in this?
That's a good question.
I think one thing that came to my mind was like just even like health professionals' perceptions of people, like when they walk in, and like just maybe judging people based on like what they're wearing or how they smell, like things like that. And maybe the care that you provide isn't as thorough if someone looks like they've been living on the street or isn't in as healthy of a living situation as like someone else.
Definitely. And I think too, it's especially with things that are preventable, that we as healthcare providers think are preventable, things we're talking about like diabetes and heart disease, we, in obesity specifically too, I feel like a lot of healthcare providers look at that and say, that's your fault.
Right.
Whereas like if somebody comes in with sepsis, it's not their fault, they caught a disease somewhere. And so it's much more, I feel like from my experience, it's been easier for healthcare providers to provide care to people like that because it's not their fault. But it's easy to say, there were so many opportunities you had to lose weight. There were so many opportunities you had to control your glucose. Why aren't you checking and like asking why questions like that? I think not understand that lack of understanding of, again, I guess lack of access then causes the lack of care.
Right.
But it's a lack of understanding that there's
empathy.
Yeah.
Yeah. I mean, especially like a doctor's probably making so much money a year. How can they relate to someone who might be making like $11,000 a year? It's a huge difference. Yeah. Interesting. So it sounds like both of us as future healthcare professionals are pretty frustrated by how the healthcare system is treating people of lower socioeconomic status. So I'm curious about how you might deal with that as a future nurse.
I think the first step is continuing to observe how things are working in the workplace. I think as a new nurse, it's important to come in and see what's happening. But then at the same time, like grounding myself in what I know to be true, and continuing to do research about what the current disparities are, so that in a year or two I can make a productive example or a productive claim to whatever institution I'm working at as to how we can actually make it better. Because I think a lot of times, like, we're throwing around ideas right now, but it's totally possible they've already tried X, Y, and Z. So like, what have we tried, what hasn't worked, but still continuing that push of something needs to change. So
and that's
a lot more learning.
Dependent on where you're going to be working and what populations you're going to be working with. That makes a lot of sense. What what can you say about your own personal attitudes in regards to this? Like how you want to treat patients with equality?
I think that I actually have the opposite problem where I have a hard time treating people with higher socioeconomic status with the same amount of care, just because I come from a lower socioeconomic background, and my whole family does. So I think that's a problem too.
Right.
And that is something that I need to be super aware of and super conscious of. And so I just think it's important for me to do a lot of self-reflection.
Yeah.
But again, just keep learning.
For sure. Oh. Cool. I agree with that too. I mean, I think it's hard to empathize with someone that you haven't lived, if you haven't lived their experience. And so it's a lot harder to empathize with someone who comes from a completely different background than you and yet still provide equal care. So
Definitely.
That's something that we shall keep in mind in our professions. Yes. The end.